So knowing that Sonya's having shoulder pain, I want to help her so when she goes home, other than the pain cream that we've used and the manual therapy that we use to work out the chest muscles and to work out the muscles around the shoulder, we're actually going to use this tape, which is really good, to actually help put the shoulder in a better position. So I've already cut it to how I want it. What I want you to do is squeeze your shoulder blades back, just like this. Sit straight up on me. There you go. Squeeze your shoulder blades back, just like this. Hold that position right there. I start this off kind of right where the pain is around the shoulder. I'm rotating it back, so I'm trying to get into a back rotated position. And because there's so many muscles in the shoulders, the rotator cuff muscles, I'm actually adjusting this tape to try to fit for that, so that we are coming into a back position to take pressure off the shoulder. Now, I don't want anything doing the job for me that the muscle should do. A lot of times patients come in and say, well, what about the strap? If I had a strap to pull me back into good position, wouldn't that be better? Well, the problem with that is, what happens when you take the strap off? The muscles that were supposed to keep your shoulders back have now gotten weaker because the shoulder strap is doing the job for them, and now you're stuck dependent on a strap to pull you back in a good posture, and when you don't have it on, you go into worse posture than you had before. That's the same thing for back braces. I like back braces, but I would never want you to be dependent on a back brace because your stomach muscles are supposed to be bracing your back. And if you wear it too long, you can make those stomach muscles weaker. Same thing for the shoulder. So this is the only piece of tape we're going to use. How does that feel? You tell me if it's good, because I can always adjust it.
Yeah,
just relax your shoulder. Good. And it's keeping us back a little bit. But again, the major thing is we hold it there, but to start showing the stretches and exercises that are going to get us in a good spot. Next, we're going to do some adjustment. The neck adjustment goes along with the shoulder pain because we talked about earlier how poor posture around the shoulders and around the upper back and around the neck can lead to shoulder pain. So I always like to make sure that we're keeping the neck loose as well. So we're definitely tighter on this right side than we are on the left. Here we go, left. Good girl. There we go, let it go, let it go. Good girl. Let it go, let it go. Very nice. Very nicely done. Take a deep breath. This is key, because right now we're tight in the upper back, which means this is where we're at. The posture's going this way. So what I'm gonna do is I'm adjust that back to get us backwards that way. Keep your chin tucked. Make a wish. Make a wish. Make a wish. Make a wish. Beautiful. Come on up. Very nicely done. Very nice. Good. I'm not even gonna say anything. Show me the wrong way to sit.
My shoulder.
That's setting yourself up. It's not it's the most comfortable thing in the world. It looks extremely comfortable. I have slept this way before, but the problem is you're jamming your shoulder down. So over the course of the night, all this pressure from your whole entire body is going through the shoulder and it's causing pressure to where that collarbone connects to the end of the shoulder. So without changing your complete sleeping posture, let's say I always have to sleep on my right side, and I understand a lot of people are just like that. I'm kind of the same way. You have your side of the bed. Instead of sleeping completely like that, what we're going to do is, I'm going to bring a pillow. First, stay right there. Rotate your shoulder under so you're actually sleeping on the back of your shoulder. Here's this pillow for you. There you go. So you're actually sleeping on the back of the shoulder. So you're not necessarily all the way on the side, and you're not putting pressure all the way through the shoulder.
Feel the difference.
Feel the difference.
Yeah.
Right. So that inflammation is not building up over the course of the night, and you're putting weight on the back of the shoulder, which is not going to distribute all the way through the collarbone. So that's the best way to sleep. This is a great stretch called corner stretch to loosen up your pec muscles and get range of motion across your chest.
Actually, it feels really good. Feels straight.
And relax. So, all done. I really appreciate you. Thank you. This is great information. A lot of people do have shoulder pain. It's just one of those things that it doesn't even take trauma to have shoulder pain. So if you're having some discomfort, make sure you watch what your sleeping posture is doing. If you have inflammation already, I do encourage you to get our pain cream that has turmeric in it to start reducing the inflammation. Come by and see us or your local chiropractor that can help you out with shoulder pain. Make sure you're getting adjusted. Make sure you're sleeping right and live without pain.